You've got a knee patient in and you think they may have sustained a meniscal injury. What do? How do you test that that is the case? This research here suggests that there's certain tests for meniscal tears that seem to be better clinically. And in this video, we're going to go through a meniscal injury special test cluster. So for our meniscal testing cluster, we've got a cluster where we look at the joint line palpation, McMurray's and Thessaly's. So we'll go through the first two first. So for joint line palpation, we're just going to bring the patient's knee up into a little bit of flexion, and we're simply going to palpate around the joint line. And we're going to look particularly with medial meniscal tears for medial pain that's different from the painful side versus non-painful side. So there's more intensity on the side that they've injured. You can look at the lateral joint line as well. So again, we could look at our lateral joint line, but basically we're just palpating into the joint line and we're seeing whether that feels tender and exquisitely tender on palpation. For McMurray's, what we're going to do is bring the patient into a flex position and we're going to basically scoop around. So when I come into the external rotation of the tibia, we're looking more at the medial meniscus, and then with our internal rotation, we're looking more at that lateral meniscus. And then you can just scoop around with the knee, and what you're looking for is any significant pain. Again, we can do this where we circle further away as well, but basically we're looking for pain in either the medial or lateral compartment depending on whether they've injured their medial or lateral meniscus. So for Thessaly's test, what we're going to do for the meniscus is we're going to hold the patient's arms. So we're going to get Kate to bring her right leg up, and this will be testing the left knee. Then what we want you to do, Kate, is rotate that leg around to the that side as far as you feel able to go, and then rotate back round the other way as far as you feel able to go. And rotate back round the other way. It's good. And back to the middle, and then relax. And what you're looking for is whether there's pain on the stance knee as the rotation goes around. Again, we're looking at both sides and we're looking for that for a few repetitions just so they can really see how it feels to do that. If you want to be a more confident therapist and effectively manage patients really optimally, then press subscribe and hit the bell icon. That way you won't miss any of these videos where we give loads of content for therapists on how to do just that. Plus my ultimate course on MSK assessment, head over to the website physio+fitness.com where you can check out the course MSK Masterclass. If you like that special test cluster video, then I know you're going to love this one. Check it out.